Welcome. This is Thomas, the host of the My Glaucoma Journey podcast. This is episode 2. I will talk about the difference between an optometry office and the glaucoma center in terms of diagnostic equipment. Then I will describe my experience with the trabeculoplasty laser procedure. After college, I started my professional career, which gave me both medical and vision insurance. I am fortunate to live about 20 minutes from an academic glaucoma center, meaning it is part of a medical teaching program. The doctors there are glaucoma specialists and supervise research to learn more about glaucoma and perfect the surgical procedures to reduce damage to the optic nerve. As a new patient at the glaucoma center, I realized that although they take nearly all ages, I was usually the youngest patient by several decades. Overhearing some of the conversations in the clinic, some of the older patients don't have someone reliable to help them with the daily eye drops. A few of the patients are first-generation immigrants and don't understand the importance of the daily eye drops. If you are familiar with the visual field test, the version in the optometrist office is often a smaller machine, while the version in the glaucoma clinic is about 3 times larger. I still use an optometrist for my eyeglasses and contact lenses. I will talk about that in another episode. At the glaucoma clinic, you are given an eye patch, a sturdy version of the costume patch you might wear to be a pirate at Halloween. With the eye patch on, you place your chin onto a chin rest so you can look into the white background. When the visual field test starts, you push a button every time you see a small dot of light appear for a second on the screen. With that large white screen, I can tell that I have a sort of black cloud or blind area in half of my left eye's visual field, so I can actually see the area of blindness caused by damage to the optic nerve. For a needle-free test, it's hard to sit still for the 5-minute visual field exam, especially when I know that I can't see all of the light flashes. There are a few videos online showing how glaucoma specialists interpret the data from the visual field exam, including the presentation on UCTV that I discussed in episode 1. Another diagnostic exam is checking the pressures inside your eyes. Several eye drops are used to numb your eyes and dilate your pupils. In the past, waiting for those eye drops to take effect meant sitting in the waiting room for about an hour. Initially, you can read a book, but gradually, as your pupils dilate, you can't read anything. The waiting area at the glaucoma clinic doesn't have a TV, and there wasn't much fun in people watching there, so I basically sat there until they called me back into the exam room. As I described in episode 1, the pressure sensor they use in the clinic is gently placed right up to the surface of the eye to detect the intraocular pressure. Since your eye is numb, there is no discomfort, but you have to keep your eyelids wide open for a couple of minutes to accommodate the sensor. In my first couple of years as a clinic patient, the pressures and the damage to my left eye were relatively stable. After that, during a routine annual glaucoma check, the doctor told me the damage to the optic nerve was getting worse and offered a laser procedure that same day. No overnight prep was needed. It is called a trabeculoplasty, which creates new drain holes in an arc along the curve of the iris in an effort to decrease the intraocular pressure. The doctor used an eye drop to numb my left eye, then I sat at the laser device. With each laser impulse, I felt a mild pinch on my eye, but not enough to stop the procedure. After the laser procedure, the clinic team asked me to stay in the waiting room for 15 minutes to make sure my vision didn't change before I drove home. I did not experience any pain or swelling after the procedure and did not need to wear a protective eye patch. Nor did I have to come back in the next day for a follow-up exam. The same procedure was also done on my right eye a couple of weeks later without any problems. Follow-up visits indicated that the drains created by the laser did not help to reduce the pressures in my eyes. In the next episode, I will talk about my experience with a trabeculectomy, which is the next level of procedure. Thanks for listening. If you want to contact me, the email is myglaucomajourney@gmail.com. That's myglaucomajourney@gmail.com. In the next episode, I'll talk about the trabeculectomy.